Last year, I was tremendously honored to receive the Americares Humanitarian Spirit Award. But this year, I'm even prouder to present this award to 60 million of my colleagues, the world's healthcare workers. The COVID-19 pandemic has certainly shown the world how critical healthcare workers are. They're at the front lines of infectious diseases, and they must perform at the highest level consistently. In this pandemic, we've asked doctors and nurses especially to work long hours, to adopt new protocols, to be flexible, and assume tremendous risk to themselves and to their families. In the United States alone, nearly 1,000 healthcare workers, mostly nurses, have died from COVID-19. Created in memory of Americares founders, the Humanitarian Spirit Award honors outstanding individuals who exemplify extraordinary courage and commitment to humanitarian endeavors and making a real difference in the world. So it is really fitting that this year's award goes to the world's healthcare workers. Now again, there's 60 million of them, but we wanted to talk about 5 who we think are really representative of what this award means. Nisha Medan Abdul Karim Sheikh. He spent years in poor health, and in his own words, he was just wandering in the slums of Mumbai, India. When his health improved with care from an Americares mobile health center, he wanted to share his experience of finding health and hope. Now, Nisha Medan is a trained Arigo Mitra. That means health friend. He encourages his neighbors to seek care at Americares mobile health centers. Community health volunteers are the very foundation of health in many countries. So thank you, Nisha Medan, for demonstrating the power of health. In Puerto Rico, Hurricane Maria was followed by months without electricity, a financial crisis, and then a swarm of earthquakes that drove people into the streets trying to seek safety. Now Puerto Ricans are dealing, like the rest of the world, with COVID-19. Through it all, Dr. Miguel Marrero and the team at Americares have provided mental health training to thousands of health workers and first responders. This training can really serve as a lifeline for health workers who care for survivors, and they must endure the stress of the disaster themselves. It's a true burden, and it's one that Dr. Marrero and the team know all too well. So thank you, Dr. Marrero, for meeting mental health needs during multiple disasters. When COVID-19 emerged as a threat, Dr. John Keane Zilly didn't wait for cases to arrive in Haiti. He asked his community at St. Roch Health Foundation Clinic to wear masks and to increase hand washing. And they did. That demonstrates a trust that Dr. Eloy has built with staff and patients in his 11 years as medical director. Dr. Eloy empowers everyone around him, from students to health volunteers to medical staff, to live a healthy life. Thank you, Dr. Eloy, for being a catalyst for health in your own community. Dr. Maria Mayumi Giliana is a family practice doctor in the Philippines, but when disaster strikes, she cares for survivors as a volunteer member of the Americares emergency medical team. Dr. Giliana knows the people most affected by disasters are living well below the poverty line. Often the only care they receive is what she will provide. Dr. Giliana listens to her patients, offering a space for loss and grief. Such important work, and we wanted to thank you as well, Dr. Giliana, for supporting patients' physical and emotional needs. Javon Muhammad was already dealing with the COVID-19 pandemic when Hurricane Laura swept through her community. Ms. Muhammad is the CEO of SWLA Center for Health in Lake Charles, Louisiana. Her community is mostly Black, mostly poor and elderly, and therefore very vulnerable in every disaster. After the storm, Ms. Muhammad established her damaged clinic as a community relief hub. Ms. Muhammad recognizes that her community will not heal until they address the condition that impacts health here every single day: poverty.
If we prioritize the health care of poor people in poor communities in the way that we prioritized COVID, if we make that a national agenda that we must make people well, then we will be doing fine. Poverty is a public health crisis.
So thank you, Javon Muhammad, for your dedication and your advocacy for health for the most vulnerable. And let me just say thanks to all the healthcare workers out there. This has been an unprecedented time. And in so many places around the world, you have risen to this unprecedented challenge. So on behalf of all of us, thank you. You truly deserve this honor.